there's gonna be a little pain. Alright, don't move, Elli, don't move. Doing great. Maybe now finding little opening. So we'll do the tear trough. We made the opening. I go under the muscle, and then you're doing good. And whenever I have resistance, that is good there. I redirect. Aspirate it for negative. I will start injecting as I'm coming out. Okay. Now I have to always remember that all these hyaluronic acid filler will absorb also some water in 2 to 3 weeks. I did everything kind of deep with the cannula under the muscles, and then to plump everything from inside out, and you could see already the difference, and then it's gonna be again even better in 2 to 3 weeks. Let's see this side. Okay, again you could see that it has a little ridge in the tear trough, and then above it is the deficit. I always try to be little away from the malar edema, which is kind of like here, so that in the future start accumulating some water, then I'm away from that. I don't disturb it, and I don't make it worse. Again, I go like under the muscle, feel the pop, then gently can advance like the tip of the cannula up above. That's the marker, and I aspirate, and then kind of tent down so that again I'm plumping from inside out. Start injecting a little bit as I'm coming out, and I watch what I'm doing. Again, I tell always my patients, under eye fillers always about improving the whole thing. Don't have to be perfectionist in this area. Less is more, and then you have always to take into consideration the some absorption of water into the area in a few weeks. So you underfill rather than overfill, and that's the main reason why people sometimes get into trouble in this area. Very rare, sometimes you have like a mild reaction to it that can happen, but most of the problem in this area is by people overfill it, and then they try to be perfectionists just from the first time injection, and then when it absorbs water in a few weeks it becomes overfilled, kind of looks like under eye worms, you know. So we spread the whole thing all around so that we have a little amount in each area. Okay, and then you could see it's already better, and again, as I told you, we're going to have a little bit of absorption further in the future, will make it even better. What I'm doing here is sometimes unnecessary, but I just, again, this ridge that she had from before, I want to push the filler just above it so that I don't actually make it worse, because you know, sometimes if the filler goes under it, then it's gonna push it up even more. Right, Elli?